Live from the Scripps Studios, this is 10 News.
County leaders reported 76 more cases of COVID-19 in San Diego today. Good evening. I'm Steve Atkinson. The total number of cases is now over 1,500, and the county estimates about 250 San Diegans have recovered from the virus. The county also reported 5 more deaths. That brings our local total to 36. And around the U.S., more than 23,000 people have now recovered from this disease. Now, New York continues to see the worst of the coronavirus, while new outbreaks are springing up all around the country. But ABC's Marcy Gonzalez shows us the new information that may offer a glimmer of hope.
With the warning from President Trump that there are still some, quote, terrible days ahead in the coronavirus battle, New York seeing its worst yet.
The bad news isn't just bad. The bad news is actually terrible. Highest single day death toll yet.
At Maimonides Hospital in Brooklyn, Dr. Daniel Nicola, part of the team desperately trying to save lives inside this makeshift ICU. The emotional toll on him clear as he makes heart-wrenching calls to isolated patients' loved ones.
Telling someone that their family member may not make it, it really does, it takes a lot.
With so many healthcare facilities overwhelmed with COVID-19 patients, this cathedral in New York City now transformed to help. Tents and beds set up where Easter services would have been held, ready to treat the sick.
The cathedral has always been a place for spiritual healing. And now it's being used as a place for physical healing.
Now hotspots emerging, including in Washington, D.C. and Baltimore, Louisiana, Chicago, Detroit, and Pennsylvania. Cases surging in Florida, too. The Miami Beach Convention Center now turned into a field hospital, as a new model from the University of Washington gives a glimmer of hope, projecting a lower national death toll over the coming months, but only if social distancing continues.
We may be reaching the point where the impact of the coronavirus is beginning to level off. But it also should be an encouragement to every American to keep doing what we are all doing.
Marcy Gonzalez, ABC News, Los Angeles.
Stressing to stay the course. All right, a crew member from the San Diego-based ship USNS Mercy has now tested positive for COVID-19. Now, that medical crew member is in isolation on the ship and will soon be transferred off to an isolation facility. The Navy says the incident will not affect the ability of the Mercy to receive patients. That ship is serving as a referral hospital for non-COVID-19 patients admitted to shore-based hospitals. The 1,000-bed ship is staffed by more than 800 Navy medical personnel and support staff. County leaders say that there are some early signs that the drastic measures we've been taking may be working, but they do warn we still have a long way to go before we can consider a return to normal.
The reality is we have to stay the course. The progress that we are seeing in San Diego and the progress that we are seeing in California is a result of the early actions that we took, but more importantly, a result of the widespread adoption that we have seen from each and every one of you out there. And we need you to continue to do that. Because if we misinterpret any evidence or data to suggest that the progress we were seeing in any way can allow us to lessen the commitment that we have, then all of the meaningful progress that we've taken to date will be undone.
Strictly following public health orders now could mean a quicker return to normal when that time comes. And armed with a new $25 million commitment from the city and the county, San Diego Mayor Kevin Faulconer says we are positioned to address our homeless crisis like never before in this pandemic.
We can address COVID-19 crisis and our homeless crisis at the same time. And we are at a moment where we are significantly realigning our homeless services in order to address this. And now, at the same moment, we have $25 million available to treat and stabilize many of the same individuals who are most vulnerable to this virus.
In addition to the housing, that $25 million will go for services for those struggling with mental illness and addiction. Now, the funds, they have been tied up in court until now, left over from the old redevelopment zones, which the state eliminated back in 2011. The last of the federal stockpile of the N95 respirators, surgical face masks, and other medical supplies, they have now been distributed to healthcare workers. The U.S. Department of Health and Human Services says they are sending out all of the remaining personal protective equipment in its inventory. A review of federal purchasing contracts by the Associated Press over the weekend showed that federal agencies waited until mid-March to begin placing bulk orders for that equipment. The department has recently made an order of 600 million N95 masks. ABC News is out with a new report that finds U.S. intelligence officials learned of the COVID-19 outbreak in Wuhan, China back in late November. For more on that investigation, let's go to my co-anchor, Kimberly Hunt. Kim.
Well, ABC News says several sources reveal that information was given to the president. In response to this report, the Government Agency for Medical Intelligence took the rare move late today to put out a statement calling this report incorrect. And ABC's Alex Perche has the very latest from Washington.
A U.S. intelligence report now coming to light is raising new questions about the Trump administration's response to the coronavirus outbreak. An ABC News investigation confirming through 4 sources that the National Committee on Medical Intelligence was aware as early as November of COVID-19's uncontrolled spread in China by monitoring communication and satellite images there. The committee detailing how the disease could pose a serious threat to U.S. forces in Asia. Their analysis also finding Chinese leaders knew the outbreak was out of control, but opted to hide that information from foreign governments and health agencies. The report was vetted by intelligence, military, and White House officials for more than a month before appearing in the president's daily brief in early January. As recently as 2 days ago, President Trump said nobody saw this coming.
This came out of nowhere. Nobody would have ever thought a thing like this could have happened.
The president asked about the intelligence report this evening.
When did you first learn about the intelligence, and could you have acted on it then?
When I learned about the gravity of it was sometime just prior to closing the country to China. I don't know exactly, but I'd like to see the information.
And tonight, in a rare official statement from the National Center for Medical Intelligence, Colonel Shane Day saying, in the interest of transparency during this current public health crisis, we can confirm that media reporting about the existence/release of a National Center for Medical Intelligence coronavirus-related product assessment in November of 2019 is not correct. No such NCMI product exists. Alex Perche, ABC News, Washington.
President Trump has suggested that he sent that alarm out right after he was briefed, also saying the World Health Organization was slow to put out the alarm, which he also then said allowed this virus to become a global pandemic. Steve?
All right, Kim, thank you for the update. Turning now to our weather, our meteorologist, Angelica Campos, is tracking the next round of rain. We've had a little bit of a break, but it's coming back, Angelica.
Yes, it's been on and off, Steve. For San Diego, a bit of a break, but for other parts of the county, it's been nonstop. And because of the threat of more rain and even heavy rain, we're going to keep the flash flood watch in effect. That just changed as of 9 o'clock, and it will be in effect until 5 p.m. on Friday. So periods of heavy rain can still be expected. Winter weather will be impacting our mountains overnight and into tomorrow through at least noon. Our pinpoint Doppler Live is in high resolution, so you see a lot more green than what's actually falling. In Escondido, we have some heavy rain stretching just to the west, also in Alpine and snow in our mountains. Even Julian getting a few flakes out there. I'll show you how much more is going to be falling overnight into tomorrow, and also why we'll see more heavy rain through the end of the week.
That is the sweet sound from downtown San Diego every night at 8. It has become a way for people to show their appreciation for our healthcare workers during this pandemic. And as our 10 News anchor Lindsay Pena shows us, it is spreading to other neighborhoods.
That's the sound of appreciation. Every night at 8, people come out onto their balconies, open their windows, and just make noise. People living in downtown San Diego say it seemed to really get going last Saturday.
Everyone was making noises, and we've been doing it every night since. It's pretty cool.
The whooping and hollering and even flashing lights are all inspired by other similar nightly celebrations around the world. The trend first sprang up in Italy as a way to show appreciation to healthcare workers, then began gaining traction here in the U.S.
It's cool to see everyone out on their porches at the same time, and everyone's yelling and they're all in it together. For the most part, it's gotten louder each night. Our complex has definitely picked up on it.
A little bit earlier in the evening, right at 7 o'clock to be exact, people here in North Park make some noise of their own.
Some use pots and pans and spoons or just their voices, but the sound has definitely grabbed people's attention.
In a difficult time like this, it brings joy to your heart to be able to, show your appreciation.
Maria DeSantis says participation has been steadily growing since the weekend when they had only about 3 or 4 people. For her, it's about showing appreciation to anyone serving others right now.
So it's those in the grocery stores, the laundromats, the people at the post office, the guy that delivers my mail. And it's an appreciation for those that we don't even think to appreciate, as well as all the first responders.
Lindsay Pena, 10 News.
And brings our community together. What a great way to show our appreciation.